Well, hello there, and welcome to this week's weekly installment of Bingham Healthcare's Be Informed webinar series. I'm your host, Michael Brandis. As you know, because of everything that's been going on, we've stopped doing in-person seminars for the time being, and we've transitioned to doing these online live webinar series so that we can still continue to provide medical information to the community. So for everyone who's joining us on Facebook Live today, thank you very much for being with us. Also, there was invitations sent out beforehand. Excuse me. There were invitations sent out beforehand, and people were able to submit some questions in advance. So we're going to be going through some of those questions today. And then if you're watching this live, please feel free to submit your questions in the comments section on Facebook, and we'll be sure to try to answer those for you as well. If we run out of time and we aren't able to get to all the questions today, we're going to make sure that we submit those those questions to our doctor, and we will be able to get responses for those. And if you're watching this after it's been recorded, either on Facebook or on our YouTube page, on Bingham Memorial's YouTube page, please feel free to submit questions. We have a social media team that's always looking out and reading the questions that come in from these webinars. What I'd like to do now is I'm excited to introduce our guest doctor today. It's Dr. Jared Wartham, and he's a board-certified pediatrician who just recently joined Bingham Healthcare. Welcome, Dr. Wartham.
Thank you. I'm excited to be here. Appreciate you letting me come.
You're welcome. We really appreciate you taking the time out of your schedule to be with us and to be able to answer some questions and help the community get to know you a little bit better.
Wonderful.
Okay, so just to let everyone know, what I'm going to do is take a few minutes to introduce Dr. Wortham, allow him to talk a little bit about himself and his practice, and then we'll transition into the Q&A session of the webinar series and go from there. So, Dr. Wortham, could you tell us maybe a little bit about your background, perhaps where you were born and raised, where you went to school, and what inspired you to go to medical school?
Yeah, of course. So like most people, I was born at a very young age. I was actually born and raised in Wyoming, and southwestern Wyoming is the area where I grew up. Kind of grew up around horses. We did wagon trains every summer. It was super great. My senior year of high school, I ended up graduating from Preston High School. So the Napoleon Dynamite era, that's what I graduated from. It was great. And then I ended up at ISU for my undergrad and my grad school. From there, I went to medical school out in Iowa, and there was a program where I got to travel. So I ended up 2 years in Iowa and 2 years in Wyoming doing medical school. And then my pediatric residency, that's another 3 years of training, was out in Akron Children's Hospital in Ohio, in Akron, Ohio. From there, I was able to get a job with St. Luke's Pediatrics in Twin Falls, Idaho. And I was working there as a general pediatrician for about 5 years. Was able to do a lot of fun stuff. Did nursery work, in-hospital work, and also in the office work. So it's kind of a quickie about me.
Okay, so when you were in medical school, what is it then that interested you in becoming a pediatric, going into pediatrics?
Yeah, so from day one, I've always wanted to work with kids, and it's mostly because I would say I relate with kids a lot better. My wife would say that I'm a giant child, and so interacting with adults is a little harder for me. Interacting with kids is very easy for me. So the hard part was not deciding whether I was going to work with kids. It was what portion of medicine in kids was I going to work with. I initially thought about different types of surgeries with kids, including orthopedic surgery, and then different type of subspecialties such as like pediatric ER, but realized that as I went through my training, that I really wanted to settle in a town or in an area that was very similar to Idaho Falls, Pocatello, or Twin Falls. And so being a general pediatrician was a much better choice for me to be able to be in an area that I enjoyed. So,
excellent. And when you talk about your specialty of pediatrics, could you give our viewers a little bit of an overview of what you do on a daily basis or what you specialize in?
Yeah, so we could just kind of go through my day. So in the morning, typically I would run over to a nursery. So right now I work at the Grove Creek birthing center, and I would run over to the nursery and see whatever babies are there for me to see. We'll take care of them in the nursery, and then once I go to office after rounds in the morning, rounds in the morning could also include patients that are in the hospital. Right now, there's not a lot of kids in the hospital because of COVID, which is really good. But seeing kids in the hospital is also part of my job. And then when I go to clinic, a lot of times we'll see, most of the day will be well child visits, which is preventative visits, immunizations, parental education, and then also anything from like chronic diseases to injuries and illnesses of kids that are in the community.
Excellent. Thank you for that. And I think we'll get into a little bit more depth when we're answering some of the more specific questions. So our viewers, you'll be able to get an opportunity to get to know Dr. Wartham a little bit better and, and, being able to schedule an appointment with him if you are looking for a pediatrician in the area. To let you know that Dr. Wartham, he actually sees patients in Blackfoot and Pocatello. And he actually is based out of there. His office is based out of our urgent cares. We have an urgent care in Blackfoot, across First Choice Urgent Care and Family Medicine across the street from McDonald's in Blackfoot. And then we also have a First Choice Urgent Care off of Bannock Highway in Pocatello. And he sees patients in both of those office spaces. Just to let you know, if you'd like more information about Dr. Wartham, if there's something that's not covered here today, or addresses for office location or a telephone number to call, you can visit www.binghammemorial.org. www.binghammemorial.org, and you can, under Find a Doctor, you can find additional information about Dr. Wartham. I should note he does speak fluent Spanish, so if there are any Spanish speaking folks out there who are looking for a bilingual pediatrician, Dr. Wartham would be perfect for you to be able to schedule an appointment with. And that still holds true. That is correct, right, Dr. Wartham?
Yes, I still speak Spanish.
Okay. Mm-hmm. I just wanted to confirm. I just wanted to make sure I have that correct.
That is correct.
I don't want to mislead people. Okay, so now what we're going to do is I see that there's some questions that are coming in, and like I said, I have some questions that people have asked in advance. So I think we're going to move into the Q&A portion of the Bingham Healthcare's Be Informed webinar series. And I would like to make a disclaimer that even though Dr. Wartham is he's a board certified pediatrician, he's a doctor, and he's answering the questions today, I just have to let you know that you shouldn't take that as an official or 100% a diagnosis or anything. For that to be truly stand, you would actually need to make sure you and your children actually saw Dr. Wartham in person so that he could properly evaluate you and be able to then give you a proper diagnosis after he's done an evaluation. So just take what he's saying will be useful, but for a real diagnosis, you'll want to schedule an appointment with Dr. Wartham in person. Okay, so Dr. Wartham, the first question that I have here from a viewer is, I have heard that children don't develop allergies until they are 3 to 5 years old. However, I think my 2-year-old suffers from allergies. My husband has really bad allergies. Is it possible for you to be able to diagnose a 2-year-old for allergies, and are there remedies?
So that is actually a wonderful question. Allergies is a really big topic. And so to answer your question very directly, yes, 2-year-olds can have allergies. But there's a little caveat. It's a little difficult in that there's lots of different kinds of allergies. So you have allergies that can start up even in the infant ages, like 2-3 months of age. Those are typically food allergies, like a milk protein allergy, or an egg allergy or a peanut allergy, and then they get worse as they grow. And then there's more environmental allergies that can kick in. The allergy that we typically hear comes on a little bit later in life is what's called allergic rhinitis. So that's the one where sometimes you'll hear people say, oh, you can't really get that until you're 3 to 5. But typically I've noticed kind of in my own practice that about 18 months of age, you can start to get a little bit of allergic rhinitis. And there's a few medicines that you can use to treat that. As far as like home remedies, there's not a lot of research on great home remedies. I'm all for like trying anything that you'd like at home, as long as it's not going to be harmful to your child. Some home remedies that I've heard of is getting some honey that was made in the area you live. Some of it has been making sure that your child eats like lots of different fruits and vegetables, especially like if those fruits and vegetables are local. Those sorts of things are supposed to help, but there's not great research to say that it definitely helps with allergies. But yeah, so there are different medications that you can use, even in an 18-month to 2-year-old, to help with allergic rhinitis. And then if there's other types of allergies like hives or gastrointestinal allergies or food allergies, then those sorts of allergies, a lot of times there are some great resources that come with our allergist friends in testing and in treatment. So.
Okay, excellent. Thank you, Dr. Wortham, and thank you to the viewer who submitted that question. So the second question that we've been asked, and I think that you'll be able to elaborate on the negative aspects of doing this. The viewer has asked, does smoking while pregnant cause asthma?
I'm just going to recommend against smoking while pregnant. So, as a pediatrician, obviously, I don't want any smoking around children. So, yes, actually, I think it was in the 1990s they started to show some good data, some good correlation between if mom were to smoke while pregnant, babies had a higher risk of being diagnosed with asthma later on. The exact reasons we don't know yet. So there's ongoing research as to why it is that smoking would cause that, because there's lots of we'll just say things that go into asthma, including genetics, including allergies, and including like environmental triggers. For example, there's mold out there and cockroaches and dust mites, like all sorts of things that contribute to it. But one thing that we know does contribute to having asthma or making it worse for breathing for babies is having cigarette smoke, whether mom was pregnant with cigarette smoke or whether there's cigarette smoke in the home, or even the smell of the cigarette smoke can cause children to have a higher risk of ear infections, a higher risk of pneumonia, a higher risk of SIDS, which is the sudden infant death syndrome. So not to scare anyone or anything, but yes, smoking is very detrimental, especially for the children out there, because their little bodies just don't handle it very well.
Okay, thank you, Dr. Wortham, for shedding some much needed light on that particular situation. The next question that we have is, my 16-year-old male child still wets the bed 2 to 3 times a week. I don't discuss this with him because I don't want to embarrass him, but I see how many times he washes his sheets. Is this normal? Is there any help you can offer in this situation?
Absolutely. Yeah. So for a 16-year-old, so this is called Nocturnal Enuresis. That's kind of the fancy medical name for it. And a lot of kids have this problem. You'd actually be surprised to see the proportion of children that have this problem. Typically, it will start to go away at your early teenage years. Usually 11 and 12 is the oldest that we typically see it. So once they're older than that, we definitely want you to seek out help for him. I think that it'd be great to open up some communications with him. I know it's very embarrassing as a 16-year-old to talk about certain things. And sometimes as a parent, it's even more difficult because, I don't know, I have teenagers and they don't ever want to talk to me about anything. So just getting him in with a pediatrician allows them, as a teenager, what we typically do as pediatricians is we give them the opportunity to talk to the pediatrician alone. That way they can feel very comfortable. We let them know that it's a very confidential situation. We just talk about things. We encourage them to talk to their parents, and that way we can get them to open up a little bit more. I think that a few more details would be very helpful as far as his case. He could be, is he washing his sheets because he is actually wetting the bed? Is he washing the sheets because he's a very responsible young man and he just wants to wash his sheets? There's also other things that come in kind of the teenage years and a little bit embarrassing, but they're as teenage boys, they can have what are called wet dreams. and it'll feel like they've wet the bed, and they may be washing those sheets, and that's a completely different scenario. But if he is having what's called a nocturnal enuresis, so wetting the bed at night at 16, I think that it would be a good idea to get him some help and some support so that we can help to treat that. One of the mainstays of treatment is called the bell and pad method. They're actually little devices. You put a pad in the underwear, and it's hooked up to an alarm at night. And when the pad starts to sense any moisture, that bell goes off. It wakes them up immediately, and it teaches their subconscious to start waking up when their bladder feels full. And so that's typically the mainstay of treatment, especially for his age group. But there would also be some anatomical things that you would want to look at in order to make sure there's nothing else going on with him.
Okay, thank you very much, Dr. Wortham, for responding to that. And thank you to the viewer for submitting that question to us today. Okay, so this next question, I imagine, will be a little bit more not difficult, but tricky to answer, just because I'm sure there's still a lot of ongoing research around this particular topic. But the viewer has asked, when the COVID-19 vaccine is approved for those aged 12 and up, should we get it for our kids? I'm concerned about whether or not it's safe. Yeah,
I tell you what, I bet everyone is so tired of COVID at this point. Yeah. So I am as well. And so, looking at the vaccines, I've kind of been following that vaccine data as it's been coming out, and I'm kind of a nerd. So I'm really excited about like the science behind it. I really like it. As far as the safety profile goes, looking at recommendations. So I typically will follow recommendations from the CDC, the FDA, and the AAP. So the CDC is the Center of Disease Control. They're kind of our governmental body that helps us with big pandemics like what we're going through. The FDA, they're the Food and Drug Association, but they regulate whether or not drugs, medications, vaccines, whether or not those are safe for our population. And in order to have a vaccine come out, it has to go through some pretty rigorous testing. So unfortunately, there's some of that testing that we are not doing right now because we don't have the time for it. Those are the long-term testings. Kind of doing as I was looking through and doing some research the other day about vaccines in general, typically all of the vaccines that have come out have never really shown to be or cause any sort of long-term effects past a 10-year mark. So I think that we can assume, again, it's an assumption because we don't know yet, we can assume that these ones are going to be similar in safety. That being said, one thing that I always look at with my vaccines is if I were to get my child the COVID vaccine, what is it that I'm going to be avoiding? And what sort of adverse effects are going to be coming from the COVID vaccine? So, for example, some adverse effects that we've seen in adults and people 16 and above, they're currently doing the studies below, but 16 and above, we've seen some people have fevers, some people have sore arms, kind of like getting a tetanus shot. Some people, they'll have some body aches for a while afterwards. And so that's kind of what we've been seeing. So those are the adverse effects that we've been seeing from the COVID vaccine. Now, what are the adverse effects that can come from COVID? So luckily, a lot of kids will get COVID and it'll look like the common cold. They'll be just fine. They won't have any issues with it. But there's a small population of those kids that will actually end up in the hospital. They'll be very sick and need to be on a ventilator. But what's more concerning for me is there's a population of children about 1 to 2 months after having COVID, their immune systems get revved up, and it creates this inflammatory syndrome that's just all throughout the body. We actually had some of these kids in the hospital while I was working in my previous hospital, and it was very difficult for them. They had inflammation in their heart, inflammation in their lungs, inflammation in their kidneys and in their liver. It was just kind of everywhere. And so that's the complication that I'm hoping that we avoid with these vaccinations. So is that full body inflammation. I'm hoping that with these vaccinations in kids, we can avoid getting that secondary inflammation called MISC. Very rare, but also very detrimental for kids. So I guess to answer the question, is it safe? I honestly don't know yet because the FDA hasn't finished their studies with it. But if the FDA does come out, if they have done their rigorous studies like they typically do, I would probably recommend it to most of my patients to get it in order to avoid the complications that can come from COVID, because they seem to be a little worse than what you can get from the vaccine. So I hope that's helpful.
Okay, thank you, Dr. Wortham. And again, if the time comes when they do have a vaccine for those that are 12 and up, if you'd like to schedule an appointment or call Dr. Wortham's office to be able to talk to him further about what other research has been done, but at that point, the phone number for Dr. Wortham, and it'll actually be coming up at the bottom of the screen at some point as well, is his phone number is 208-239-8055. Again, 208-239-8055. And you can always call. And if you have any questions, please call his office and perhaps schedule a consultation to meet with him and discuss any concerns that you might be having or anything that he can help you address with your children. Okay, thank you, Dr. Wortham, for that response. The next question that we have is, my 4-year-old won't sleep through the night. Do you have any recommendations?
This is a great question. I love it. So first recommendation, get some great headphones. Just kidding. So there are some things that you can do. There's typically at 4 years old, if they're not sleeping through the night, the main cause of this, so the majority of kids are having what's called behavioral insomnia of childhood. And there's actually a couple of different subtypes. One of them is limit setting, and the other one is sleep association or sleep onset association. And so what happens with these, the limit setting kind of describes itself. So little kids, especially 4-year-olds, starting at 2, they like to push the boundaries. They like to have their way. They're a little bit stubborn sometimes. And so setting very good boundaries, especially around bedtime and how it's going to happen, being very consistent and patient with those boundaries can be very beneficial to the child and also their sleep. The other type of behavioral insomnia is sleep onset association. So this one's a little more tricky. Kids, their subconscious or their little brains, it'll pick something in their environment and they'll associate sleep with that something. For example, if your child loves a binky and they fall asleep with a binky and you put them to sleep, they fall asleep with the binky and they're doing great. And then the binky falls out of their mouth and it falls out of the crib and they can't get it. Then they're up and they're screaming and they want mom because they can't find their binky and they need that binky to fall back asleep. That's a sleep association. So the tricky part of that is trying to figure out what is it that they're associating with falling asleep. Now, there are lots and lots of other problems that can cause difficulties in sleeping in 4-year-olds. But those are kind of the two most common. I recommend to all my parents, whenever they come in, whenever we have sleep problems, there's a book that I love called How to Solve Your Child's Sleep Problems. It's by Dr. Ferber. He was a sleep specialist at Harvard, I believe, at Boston Children's Hospital. Hopefully I'm remembering that correctly. And this book, it's a little long. It's kind of like a textbook. So if you hate reading books, I apologize. Typically, you can go through the first 4 to 5 chapters and it's enough. But it really gets into some details about like finding out, okay, what is it that's causing my child to have difficulty sleeping? And then coming up with a plan to help them fall asleep a little bit better. So I think that most parents that have actually been able to sit down and go through this book and use it, come back to me and they say it's a life saver because then suddenly everybody's sleeping and life is so much better. So that's typically where I start with the sleep problems.
Okay, excellent. And Dr. Wortham, could you just repeat the name of that book and the author again for our audience, just in case they missed it the first time?
Absolutely. How to Solve Your Child's Sleep Problems by Dr. Ferber. And it's also on Audible. I had to check because I love Audible. So there you go. If you're a listener.
Okay, awesome. Hopefully, that'll help be of a benefit to some parents out there that are struggling with dealing with that situation.
Yeah.
Okay, so the next question that we've had come in is: I have a 14-year-old who benefits from Lexapro. Her psychiatrist makes me bring her in once a month to get a refill, though she's never had any side effects. It's very expensive. Is this a medication I could expect to get a 3 to 6 month prescription for?
Yeah, that is a great question. So I'll always recommend, if you have a great psychiatrist, I'll never recommend against what they're doing for your child. Always make sure you follow what they're doing, because they are the mental health specialists. They really know their stuff. But there are a few things I think that can be helpful here. First off, like a monthly meeting with a psychiatrist can be super helpful. I think that all depends upon your family, your family's personality, how your child is doing, kind of like what the psychiatrist feels that they're doing, and then kind of how their practice is set up. So all of that should be taken into account when we decide when those follow-ups are going to be. I'll tell you kind of how I typically will do it with a 14-year-olds with, it sounds like probably depression or anxiety, is typically I will have monthly follow-ups until I find that they are at a very stable state and that they're better. And then we'll push it out to that 3, 6, 9 month periods. The reason why we do this, I think as pediatricians, maybe psychiatrists, I feel like we're really, really protective of these teenagers, because it's so easy for them to just like drop everything and not take the meds and then just fall right back into that cycle of depression. And so I can see why those monthly follow-ups are happening, although they can be very frustrating for parents. As far as the cost, Lexapro, it tends to be a very good one for teenage girls for sure. The cost, something that you can do is you can ask your psychiatrist about a generic version of the Lexapro. I think there's a new generic version of that one and typically your generic versions of the medicine are about 3 times three times cheaper than what your brand names are. Now, your provider or psychiatrist may have you on the brand name Lexapro for certain reasons. There's lots of data out there, lots of different research out there that he may know about that I don't. But that's one way that you can hopefully get that a little bit cheaper for yourself. And then I would approach your psychiatrist and say, hey, can we have a 3-month follow-up? Can we have a 6-month follow-up? Or what do we need to do to work toward that so that you don't have to come in every month? Sometimes they'll say, well, let's set a few goals. And once she's doing these goals for a month or so, then yeah, we can push it out to like 3 to 6 months. So I would have that conversation with them and hopefully be able to make it a little more convenient for you.
Okay, thank you very much, Dr. Wartham, for responding to that viewer. And again, I'd like to thank everyone who's watching our Be Informed webinar series this afternoon. We have a few more questions. Please feel free to continue submitting your questions in the comment section. And if we have time, we'll address those. And again, if we run out of time, we'll be sure to submit those questions to Dr. Wartham, and our social media team will provide his response in the comments. So we want this to just be for you, for the community members, to be able to be informed about various medical issues, or medical questions that you may have about you and your family. So please feel free to continue to interact with us, and we'll keep going with some of the other questions that have been coming in. Okay, Dr. Wartham, another question that's come in related to depression is, so they're asking, in your opinion, are there early signs of depression among kids, and is 5 years old too early to show any signs?
Yeah, so 5-year-old is so early for depression. If there are signs of depression, if you're worried about that, I would definitely get this one seen. So what happens at about 5 years old? If you look at the data of the childhood depression out there, I think the last time I looked, it was like 0.5% of all those kids were like 6 and under. And so symptoms of depression, which are the intense sadness, the irritability, not really caring about anything, not really having fun with anything, feeling worthless, very fatigued, very tired, either eating too much or not eating at all. So there's lots of things that play into this. Those signs can be a sign of something completely different in under 5 years of age. And so typically what I do is when we have families that are concerned about that and they're having symptoms at that age, I get them right in, or I do my best to get them in with a pediatric psychologist. Okay. So this is a specialist that did their training in basically diagnosing mental health conditions. So a pediatric psychologist are the ones that are able to put them through a battery of tests and really tease out what might be going on. Is there really some sort of depression going on with this little one? Is there some sort of developmental delay? Is there some sort of like trauma that happened a little earlier on in life that he's not dealing with well? So there's a whole bunch of, I'll just say a lot of issues that surround those symptoms when it comes to a 5-year-old. I know the Bingham healthcare system does have a psychiatrist or a psychologist, sorry, use the right term, psychologist that does that testing. His name is Travis Adams. So far I haven't had a chance to meet him, but I've heard really good things from other patients or patients' moms that have met him. And I heard that he does a very good job. So that would probably be your first step would be to discuss with your PCP, your pediatrician. And then your next step would be to have a sit down with one of these clinical psychologists and really hash it out and get that diagnosed well. So.
Okay. Thank you, Dr. Wartham. And I think just to elaborate, to anyone who might be watching, that's actually one of the benefits of having a pediatrician, but, especially Dr. Wartham, within Bingham Healthcare, because then he's knowledgeable about all the other, doctors and their specialties within the Bingham Healthcare system. And then he's the starting point, say, okay, this is what's going on. And then he's able to refer you to a specialist. And that would apply to, even like sports for athletes. We have a lot of orthopedic surgeons. We have a lot of sports medicine specialists. We have, doctors, ear, nose, and throat doctors. So Dr. Wortham is a good place to start, and then he can refer you out into our system. And he's correct. Dr. Travis Adams, if you can find more information on Dr. Adams at www.binghammemorial.org. Again, www.binghammemorial.org under find a doctor. Dr. Adams is a board certified psychologist. Is that right, Dr. Wortham?
Yes, that is the correct terminology. Psychologist.
I heard one, and then I was thinking about something else. So anyway, but he's within Bingham Healthcare, and he's absolutely fantastic. As Dr. Wortham mentioned, I've heard a lot of really great things about him and the time that he takes to treat people of all ages. He's one of 3 board certified doctors in that specialty in the region, but he sees patients of all ages as well. Just wanted to make sure that you were aware, that our viewers were aware of that. Okay, so moving on, Dr. Wortham, do you do newborn visits in the hospital before a baby comes? And then maybe I'm going to add on to this a little bit. At one point, for young parents or people who aren't aware, at one point in the process, I know women and parents are working with their OBGYNs who will ultimately deliver the baby. But at what point do you recommend them getting into you during their pregnancy to then be able to start the process of interacting with them as their pediatrician?
Yeah, absolutely. I recommend coming and visiting anytime you want. Let's say you're having a child that's on the way. And you're looking for a pediatrician, I honestly feel like it's a good idea to visit the pediatricians in your area. It's called a prenatal visit. So if you call to make an appointment, say, I just want a prenatal visit with so-and-so. And what that does is it allows you to kind of interview those pediatricians that are out there. The worst thing in the world is waiting until you get to the hospital and then you're in the nursery and then there's whatever pediatrician's on call comes and sees your baby, and then you don't like the pediatrician, or like your personalities just don't match, or the pediatrician's a jerk, or whatever else. There's lots of things that can happen that way. And so giving you the opportunity to come and interview a pediatrician, and they can talk a little bit about the birthing process, how the nurturing stuff will go, kind of give you a heads up as far as breastfeeding, all sorts of different stuff at that prenatal visit. But that gives you an opportunity to really find the pediatrician or primary care doctor that you want for your baby. And I wouldn't even limit it to, I'm a pediatrician, so obviously you should bring all your kids to a pediatrician, but I wouldn't limit it to pediatricians. There's a lot of very good family practice docs out there that see children as well. And so really look in your community and take the time to research out those doctors so you find the one you feel most comfortable with taking care of your child when you're done. So.
Okay, awesome. And I had added on to this, but just to circle back to, so you do then do newborn visits in the hospital before the baby goes home?
Oh, yes. I apologize. I didn't answer that. So yes, I do see babies in the nursery. I care for babies in the nursery. Right now I'm caring for babies at Grove Creek Birthing Center. That one is in Blackfoot. But yes, so I will come and see babies in the nursery once they're born. And take care of them there as well.
Okay, excellent. And just to let everyone know, the Grove Creek Medical Center is in Blackfoot. It's actually the birthing center where we deliver babies in Blackfoot. It's a really beautiful facility. It's small. It's private. All the rooms are private, and the staff is probably, it's easy for me to say, one of the best medical teams that I've ever interacted with. They're so friendly. They care so much about the parents and the babies that are delivered there. They just give you such one-on-one attention that you never ever feel lost. You'll always feel like you're being taken care of at all times. And it's also standalone from a hospital, which is one of the benefits of Grove Creek Medical Center. So it's predominantly just new parents and their visitors, and no one else is on within that facility. Where a lot of times other in hospitals, there's interacting with a lot of different people who are having surgeries. So this is a very private, intimate facility in Blackfoot, and you can go to the website and find out additional information about Grove Creek Medical Center as well. Okay, the next question that I have is, how can I make sure my baby is sleeping as safely as possible?
That's a great question. So I like to follow the rules of having babies. So first of all, we should have babies sleeping alone. So in their own bassinet or in a crib, or if you really need them super close, some sort of co-sleeper. The goal of sleeping alone is to keep moms and dads off of baby. So we don't want to accidentally smother baby. So I don't want to be scary, but there's always like several babies, I'd say up to 100 babies a year, that end up accidentally getting smothered by mom or dad. And it's very, very traumatizing for the family. And so you want to be very careful with that. So sleeping alone is kind of how we avoid that. Also recognize that even the weight of your hand or your arm on top of the baby, it lowers their ability to take a deep breath. And they're so small that they don't have big reserves. And that's typically where they get themselves into trouble, is even though they're breathing, not completely smothered, they're taking shallower and shallower breaths. And so that's why there's such a big push to be sleeping alone, or keeping them safe, keeping your body off of their body. I heard that in your smaller apartments in Europe, where there's really not room for another crib, families will actually take a laundry basket or a little box, put some bedding in it, and then put baby in the laundry basket or box, and it'll be right on their bed. So they're right next to you, but there's no way that you can accidentally put your hand or arm or accidentally squish baby. So that's number one. Number two is you want baby sleeping on their back. On their back is the safest, and that's been shown as the safest since, I believe, the early 1990s. It's been study after study after study. The biggest concern from most parents when they're sleeping on their back is they always ask me, are they going to throw up and aspirate and die? And the answer is no. So when babies throw up or when they spit up, when they're laying on their back. They have wonderful reflexes that actually protect them from choking on that. They'll actually gag and spit and throw up and turn their head in a way so that doesn't really cause a problem. If you do notice that they're doing that, you don't have to sit there and watch them. I like to pick them up and lay them down face down on my arm and pat their back and let them kind of spit and choke and gag. Eventually that'll all come out and they'll be breathing okay, and then you can lay them back down in the crib. It's definitely been shown we tend to have a little bit of flatter heads now that we're all sleeping on our backs. But if you're very vigilant about it, making sure they're getting plenty of tummy time, not sitting in the car seat for more than 30 minutes at a time, their heads don't typically get too flat to the point where they will need any sort of intervention. So.
Okay, thank you for that important information, Dr. Wartham. I guess I'll add on to that a little bit. What do you recommend then, like about swaddling or blankets?
Yeah, so typically and thank you for reminding me, the other thing that with safe sleep is you don't want, so there's all these like really ginormous stuffed animals and really like comfy comforters and big fluffy pillows. You don't want any of that in the crib. So you don't really want anything except for the baby, a warm pair of jammies, and that's about it. If you really want to have a blanket or a swaddle, that's perfectly okay. You want to swaddle them with their hands up by their face, and you want to swaddle them loosely, so if they do end up flipping over, they can get themselves out of it. And you really typically don't want to swaddle them for too long in their life, because you want them to be able to move and wiggle and get those joints moving. And so swaddling very early on, like up to 2 weeks, 3 weeks of age, maybe up to a month, but really they don't need it much more than that. So.
Okay, thank you for elaborating on that, Dr. Wortham, and thank you to the viewer for asking an important question that hopefully will benefit a lot of families. Okay, the next question that we have is, when does a trip to your office or making an appointment with you make sense over actually having to go to an urgent care?
Well, since I work in the urgent care, it always makes sense to come to both. Just kidding. So urgent cares are super helpful with what we call access, meaning you can just take your kid, you go in, and you can get an appointment. And sometimes a pediatrician's office, we're out like 2 or 3 weeks or even up to a month to be able to get an appointment. So typically, my typical rule is if you can wait like a day, or if your pediatrician can fit you in, I recommend always going with the same pediatrician or at least the same office as often as you possibly can. Because not only the pediatrician gets to know you and your family, the staff gets to know you and your family, and you build a relationship, and the healthcare or the quality of the healthcare is just better if you're able to do that. If you end up jumping between urgent care to urgent care or going to this ER or that ER, they don't really know you, they don't really have the records, and you don't really get the same quality care as if you were to be able to go to, let's just call it your medical home. That being said, sometimes you can't get into the pediatrician, and sometimes you just need some reassurance. You need to know what's going on. And in that case, I definitely would recommend an urgent care. I would choose an urgent care that communicates well with your primary doctor, so your pediatrician or your family practice doctor. I would pick one that has good communication between the two, so that when you go back to your doctor or your pediatrician, they already know that, oh, you were at the urgent care for an ear infection. Okay, let's check and make sure they had the right medicines, and let's make sure that everything's good from there. So yes, urgent cares do have their place. But I would recommend, as much as you can, try and stick with the same doctor and the same clinic, just so you can really get to know those people and they can get to know you.
Okay, excellent, Dr. Wortham. And I think I'd like to add on to that as well. I think maybe what this viewer is asking too is, like, I would say if they have and you can correct me if I misspeak, please, because you're the medical expert, I'm not. But if the child has fallen and they have a deep cut, going to an urgent care right away to be able to get stitches, or if they've fallen or they've twisted their ankle or have a sprained ankle or potentially broken bone, going to an urgent care would be a good option to be able to have that looked at. Some of those more, urgent situations that really do require immediate medical attention. And if it's something very serious, then to make sure that you take them to the emergency room, the closest emergency room in your area, so that can be addressed as well. Is that correct, Dr. Wartham?
Oh yeah, that's absolutely correct. So I typically would, my chain of command, or the way I'd go is, let's say you have a cut, or you think there's a broken bone. I would always just, if it feels like a big emergency, if you feel like someone needs to see them now, then definitely go to the ER. Okay, so that's number one. If you're like, this really is an emergency, go to the ER. If you get a cut or a broken bone and you're just like, I think we can go to the urgent care or somewhere to get this taken care of, I'd always check in with your pediatric office or your PCP office and say, hey, we've got a laceration or a cut. We think we may need stitches, or we think we have a broken bone. Do you guys have availability right now? And a lot of times, a lot of doctors will be able to fit you in. They'll say, oh yeah, come right in, we'll get that stitched up. If not, then urgent care is a wonderful place for sprains, broken bones, lacerations, those sorts of things that aren't super emergent. You don't end up having to sit for, I don't know how long ER waits are around here, but you don't have to end up sitting for 3 hours in the ER. And you still can have those urgent cares met. So those urgent needs met with like a laceration, sprains, and broken bones. So. Okay.
Excellent advice. And the good thing is, because Dr. Wartham's office is actually located in 2 of our urgent care, he has offices in 2 of our urgent cares, one in Blackfoot and one, our urgent care off of Bannock Highway in Pocatello. Their staff will be able to work with you to say, okay, wait, we should get you in with Dr. Wartham, or Dr. Wartham can say, okay, we can get you in with someone in the urgent care. They're very flexible, and, if you need help, just go there and they can, take care of you. And as Dr. Wartham said, he does accept same day appointments. And if you do need to be squeezed in, if there is availability, I'm sure that he would be very accommodating and try to get you in. So just your first step, just call the pediatric office, and then they can kind of guide you and help you, go make the next decision. And just to let you know, Bingham Healthcare, for those of you who don't know, Bingham Healthcare has 4 urgent cares throughout eastern Idaho. We actually have an urgent care, Ammon Medical Center, or Ammon Urgent Care, Ammon Urgent Care in Ammon off of 17th Street, kind of right after Hit Road, about a half mile down on the right. So we have an urgent care in Ammon, Idaho Falls. We just recently opened up a new urgent care in Shelley, off of Locust Street. And that actually, not only is there an urgent care in there, but we also have a family medicine provider that works out of that office, Dr. Blackner. So we have an urgent care now for the folks of Shelley. We have our original urgent care is in Blackfoot, First Choice Urgent Care in Blackfoot, and then we also have an urgent care in Pocatello off of Bannock Highway, and we're going to be opening another urgent care in Pocatello later in the year. So, okay. The next question, at what age should patients transfer out of pediatric care, Dr. Wartham?
That's a great question. So there's a little bit of like gray area here. So as a pediatrician, we're trained to take care of anything from birth up to young adult age. And the young adult age is a little difficult, right? Because you're like, well, young adults are kind of like 21 or 22 or 24. And so it all depends on how your pediatric practice is set up. So there's different ways to set up your pediatric practice. But in general, I like to start talking about transitioning to more adult doctors at about the age of 18. Sometimes they'll go off to college at 18 and kind of come back for their well visits during that time period. And you can really kind of help them out through those young adult years. But during those young adult years after 18, we really should be working on helping them take complete independence of their healthcare and really start seeing those adult doctors and starting to understand that adult world at that point. So,
Okay, thank you. The next question that we have is pretty specific. Does strep throat go away on its own?
So the answer is yes. Eventually, strep throat does go away on its own. One problem with letting it go away on its own, especially with our pediatric population, so again, I'm speaking more for the kids, is that if you allow strep throat, let's say you get strep throat, you get an infection, you let it go away on its own, you have an increased risk for a secondary, we'll just say complication from having a strep infection. So there's something called rheumatic heart disease, where your body, the immune system, we'll just say it gets crazy and starts attacking leaflets in your heart. And that's all triggered from a strep infection. So in fact, when you go to your doctor and you test positive for strep and they treat you for that strep, we're not actually treating you to make your sore throat feel better, even though it does. We're treating you so you don't end up having what's called rheumatic heart disease. And there's a few other rarer conditions that you can have from that complication. And so that's why there was such a big push as far as, I think in the 1960s is when they really just started treating every single strep that walked through the door. But yeah, so strep itself, it'll eventually go away on its own. But there are some complications if we don't treat it, and that's what we really want to avoid are those complications.
Okay, thank you, Dr. Wartham, for providing that information for the viewer that asked that question. And again, for anyone who's just joining us, thank you very much to everyone who is with us today and watching this video. Hopefully you're getting some good information and your questions are getting answered. I wanted to let you know that we are nearing the end of our webinar series on Facebook right now. But feel free to continue. I have a couple more questions for our doctor, but feel free to continue submitting those questions, and we'll either try to get to them now or we will respond in the comment section later on. But okay, the next question that we have is my 3-year-old, and I think this is a great question and you'll be able to provide some useful information. My 3-year-old is still not potty trained. Is that bad? And then maybe a little bit more general, what kind of advice do you usually give to your patients about potty training?
Very good. Yeah. So potty training, congratulations. This is fun. So at 3 years old, I don't think at any age it's bad to not be potty trained. So typically once I hit between 3 and 4 years old, we talk a little bit more about it in the office. So I typically say, I start asking, are you potty trained at about 2 years of age? And then once we hit 3 and 4 years old, if we're not quite potty trained, we start talking about it a little bit more. But potty training is not a regimented, militaristic obligation that it used to be. So you'll hear some parents brag about, oh, my child was potty trained at 15 months and my child was like stool aware at 11 months or something like that. And that's perfectly okay. They can do that if they want. And it's not going to it doesn't make the children any smarter to be potty trained any sooner or anything like that. So 3 years of age, absolutely not a problem. I'm actually starting to see the age of potty training tends to be trending up. I think because as parents, we are tending to approach it in a more kinder and gentler fashion for these little ones. So potty training in general, I have just a couple of rules for it. There's a million ways to do it, but the rule number 1 is consistency. So whatever you're going to use, whatever plan you're going to follow, you have to be consistent. So it has to be every single time, every single day, and it has to be really for a good month, 2 months, however long it takes to potty train. Rule number 2 is we ignore the behaviors we don't like and reward the behaviors we do like. And so those are kind of the principles. So if we have a child that's not potty trained and let's say they have an accident, so we don't punish for that. We just kind of ignore it. We clean it up just like we're supposed to, but we don't give any extra special attention, either negative or positive attention toward that. When the child asks you, Can I go to the bathroom? Can I go potty? Can I be in there? Then you reward them. And the reward can be as much as just praising them for, hey, you recognize that you need to go potty. This is great. So those are the two principles. Be consistent, ignore the behaviors you don't want, and praise the behaviors you do. There is wonderful guidance, actually. If you look at healthychildren.org, there's a website that the American Academy of Pediatrics puts out for parents. Wonderful articles in there on potty training and potty training methods, and lots of different ways to do it. But whatever you pick, just be very consistent with it.
Okay, excellent. Thank you, Dr. Wortham. Another question that I wanted to ask you is, how would you define or talk about the importance of having a pediatrician and how that kind of ties into the importance of having a yearly well-child visit and what maybe goes on in a well-child visit?
Yeah, absolutely. So pediatricians are all about prevention. We'll say prevention and safety because what we want to do is we want to make these children as healthy as possible. So when they do launch into adulthood, they already have wonderful, healthy habits that are going to help them throughout their lives, right? And so in order to achieve this, we try to touch base with the families as often as possible. In order to do that, we do what are called well-child visit or preventative health visits. And in those visits, we typically will take a look at growth, we take a look at nutrition. We look at risk factors for things like, do you have risk factors for tuberculosis? Do you have risk factors for lead poisoning? Do you have risk factors for, what are some other ones? Do you have risk factors for having like developmental delays or autism? So we try and follow those things and catch them as early as possible so we can correct them or help to treat them as soon as we find them. I think it's super important to have a well-child visit. Especially after the age of 3, it should just be every year. Come in and get that well-child visit. It helps us to really touch base with you. It helps us to give education and really help these kids be as healthy as possible as they're growing up. So. Okay,
excellent. Thank you. The other thing, what about how do you work with children or teenagers who are struggling with weight management issues?
Oh, this is a wonderful question. In fact, probably one of the hardest things I see in clinic is when we have what we call elevated BMI or weight issues. There's a few things, and I could talk for hours. So we'll go over just a few basics. Okay, so there's a couple of principles. Principle number 1 is what we want to focus on is establishing healthy habits. We don't want to focus on self-image, and we don't want to focus on the weight itself, okay? The weight or the BMI is a good measurement for the doctors, but it's not really going to help the child. The second one is those healthy habits or establishing those healthy habits. And there's a million different healthy habits out there. So there's specific healthy habits that have been shown and proven so that these children can basically come into a healthy weight. And those are 5 fruits and vegetables a day. They're called the 5-2-1-0 rules. So 5 fruits and veggies a day, less than 2 hours of screen time, 1 hour of exercise, and 0 sugary drinks. So unfortunately, yes, that's your soda and chocolate milk and hot chocolate. But those are the typical rules and the healthy habits you want to start establishing with them. I feel like the weight or the elevated BMI is a very difficult problem for teenagers and families in general. Because the way our culture is set up, the way we interact with each other, our relationship with food, there's so much that goes into it. But I think that focusing on daily healthy habits and not really focusing on the weight or the appearance is going to be the key in at least starting that journey.
Okay, excellent. And Dr. Wortham referred to the 5210 program. We actually have additional information about that program on our website. If you go to binghammemorial.org, you can either find it by searching for 5210, or if you go to Dr. Wortham's bio page on the website, down towards the middle of the page of the website or the web page, there's actually a box that has information about. You can click on the 5210, and it'll take you to a landing page that has information about that program. If you'd like to learn a little bit more about it. Maybe to tie in, we also have a question about how do you work with your patients if they're struggling with, or if parents, if their children are struggling with picky eating, and how would you recommend managing that?
Yeah, so picky eating, this is another fun one. So I have a couple of rules for picky eaters as well. So first off, if you have a picky eater and we're losing a lot of weight, or there's a picky eater that he will only eat French fries from McDonald's and nothing else goes in his mouth, then we need to use what's a specialist called a feeding specialist or a speech therapist that does feeding therapy. Okay. So these are our very severe picky eaters that are not gaining weight, that are actually losing muscle and losing appropriate weight because they're so picky. That being said, most of our kids are going to be picky eaters, but they're going to be growing just fine. So the rules that I use for picky eaters they usually start with having a regimented or scheduled meal times and snack times. So typically what you'll do is when you have a picky eater, you're going to take all of the unhealthy food in your house and you're going to toss it, and you're not going to buy any more. And it's really hard for me to say that because I love eating unhealthy food too. So I apologize. So you're going to take all that unhealthy food, you're going to throw it out. The next thing you're going to do is you're going to get healthy snacks like fruits, vegetables, those sorts of things, and you're going to put it in an area that's accessible to your picky eater, okay? So anytime they come to you and they're just saying, "Oh, I'm so hungry, I need a snack," you can say, "Look at these wonderful fruits and vegetables. Look at this lovely yogurt cup that we have." Lots of options that you can choose from to snack on. And eventually, so they'll probably say, "That's disgusting," and run away. Eventually, they'll come back again and they'll say, "Oh, I'm so hungry." You say, "Look at all these wonderful options we have for you." And eventually, their little hunger will drive them toward eating these healthy snacks, okay? The next thing that you want to do, so you have your scheduled snacks and your scheduled meals, and you have your healthy snacks in your house. If you have a bag of chips in the house, they can smell it. They'll know it's there. Okay. They will not eat those healthy snacks if there's anything unhealthy in the house. So that's going to be step number one. The next thing you're going to do is you're going to take your meal times and you're going to take probably about an hour to an hour and a half before mealtime. And you're going to block any eating before then. So we're going to harness their hunger is what I call it. So about an hour and a half before mealtime, you're going to say there's no snacking right now because we're going to eat dinner or we're going to eat lunch. So when they come to the table, they come to the table hungry. They don't come to the table 15 minutes after eating a bag of chips, right? Because then they're not going to eat anything because they're already full. So for dinner time or lunchtime, I would recommend always making one thing that's healthy that they like. So always having something there at the dinner table that they enjoy, and then having a whole, a different variety of food that's always at the dinner table. So once they see what's on the table, you offer it to them. You don't force them to eat it. You don't make them sit at the table until they finish their food. You offer them the food. They can either choose to eat it or choose not to eat it. If they choose not to eat it and they say, "That's gross," and they run away, which typically happens with picky eaters, you'll just take their food on their plate, you wrap it up, throw it in the fridge, and you wait, because eventually that hunger is going to drive them back to the table. They're going to say, "I'm hungry." And you're going to say, "Look at this wonderful dinner we prepared for you." And you pull it out and you warm it up and you make it yummy for them. And eventually kind of doing that reinforces, and it allows us to kind of harness their little hunger a little bit to help them try new foods. It's a little bit of a change in lifestyle for most families. So it kind of is hard. I'm not going to lie. It's not like an easy fix. You have to be consistent and very patient with these kids over a several week period as they try these new foods and as they start to get used to them. But I have noticed that families that are able to kind of stick with this consistently, it kind of opens up the world to these little ones, and they're able to see that, oh, these foods aren't poisoning me, and I'm feeling good when I eat these foods. And they actually start to eat these things and become very healthy in doing so.
Okay, thank you, Dr. Wartham. That's some really great advice. I was thinking while you were answering it, I didn't know that some of what you responded maybe already ties into this. But what would you recommend to parents to do at a young age to actually help avoid their children becoming picky eaters? Are there preventative measures that they can take?
Yeah, you can start with not having that unhealthy food in your house right off. So to be honest, that picky eating comes from the fact that they have tried something with sugar in it and they love it.
Okay.
And that is what they want, and they don't want anything else. And so really just kind of weeding your house out, or like really making it certain that those sweet treats are just kind of an every now and then thing instead of an everyday thing. The other thing you can do is when they are teeny tiny, so at like 6 months, you're going to start giving them those solid foods. Give them all sorts of solid foods. Okay. You're going to, all sorts of tastes, all sorts of textures. Have them try everything within reason, right? We don't want them to choke on like lollipops, like hard candies and peanuts. Those are dangerous. So within reason, you want them to try everything. And when they make a funny face at you and turn away and they're like, oh, I don't like that. It's okay. Put it away, but do it again later. Like get them used to those sorts of tastes, and it'll expand their palate early on. And then it'll be a lot easier for them to experiment and try new foods as they grow, especially into that toddler age. That's the most difficult when they're picky eaters.
Okay, thank you for elaborating on that. This one is a little bit more general. Maybe you could just kind of talk about maybe three or four groups. But for sleep management with children of different ages, are there any set guidelines on how much sleep an infant, so perhaps 6 months, should be getting, and how much a toddler should be getting, how much sleep a toddler should be getting, and how much sleep a teenager should be getting, and so on? Are there any guidelines that you work with in that?
Yes, absolutely. So again, I mentioned earlier about the book, How to Solve Your Child's Sleep Problems by Dr. Ferber. He actually has a chart in there that answers that exact question about, on average, how many hours do these age groups sleep. Now, the first thing to recognize is that each child is different in their sleep. They're going to need a little bit different timing on their sleep. But in general, your newborns and infants are going to sleep a lot, okay? So, and we look at their sleep as how much sleep are they getting in a 24-hour period, not how much sleep are they getting at night. This is that newborn period, okay?
Okay.
They're going to be like 18 to 20 hours a day of just sleeping, okay? And that's within that 24-hour period. As they get older, that will that will decrease. So you'll get down to like the 12 to 16 hour mark, probably around 6 months to a year. And that sleep, again, is in a 24-hour period. So between the sleep at night and typically 2 naps during the day, a morning nap and an afternoon nap, that's about the amount of sleep that they're going to get. And then they'll drop off as they hit kind of that early childhood stage. Once they hit like, probably 3 or 4, those naps will drop out. They'll start sleeping between 9 and 12 hours at night. But here's the tricky part. When they turn into teenagers, they suddenly need more sleep. And teenagers are like even harder to put to bed than toddlers. If you've ever had a teenager, it's like pulling teeth trying to get them to bed. So teenagers are notorious for going to bed late and getting up early. But those teenagers actually need probably between at least 10 to 12 hours of sleep at night. And for them to function well, because they're growing so fast, their hormones are changed. There's all sorts of stuff that's going on that they're going to need that extra sleep. And so, yeah, those are the general guidelines that I go with. And again, each child is a little bit different. And so you kind of have to go off of what they're doing. So let's say a teenager does sleep 8 hours at night, not the full 10 to 12, but seems to be awake, alert, doesn't have problems with attention, and is functioning well, then that's probably okay for him or her. But if you have a teenager that's sleeping 9 hours at night, but has fallen asleep in class, isn't getting their homework done because they're having problems with attention, is super irritable during the day. Maybe we need to increase their sleep time a little bit. So those are kind of the general guidelines for sleep time. Hopefully that answers your question.
That's great. Thank you very much. And hopefully, again, that will be useful to some of our viewers out there who are trying to figure those guidelines out. I just wanted to let you know, Dr. Wartham, that we've reached the end of our webinar, but I wanted to take this opportunity to turn it back to you or throw it back to you to be able to, answer or to provide any additional information that you might have thought about throughout this webinar that you didn't have the opportunity to address, but wanted to. Is there anything else that you'd like to talk to prospective patients about out there?
No, I would just say as a community, because I'm kind of new in the community and I don't know everybody in the area yet, I would love to hear, I don't know if it will be possible, but I'd love to hear from a lot of the parents in the area. What do they need or expect from a pediatrician? Are there certain things that they would love to see happen when they come to a pediatric office? Are there certain ways that we can help them to keep their family healthy as they grow that we currently aren't doing as pediatricians or as a medical group in general? Like what can we do to help you so that you can keep your kids healthy as they grow? That would be my biggest question for kind of our community of parents here.
Okay, excellent. And to anyone who is viewing this either now during our live webinar or later on after it's been recorded and posted on our Facebook or wherever, please feel free to submit those questions in the comment section, either on our Facebook page or on our YouTube page. If you submit those comments, about what you'd like to see from a pediatrician, please feel free to let us know, and our social media team will compile all of those comments and give them to Dr. Wortham so he can incorporate those or take them into consideration for his own practice. Okay, well, again, I'd like to thank everyone for joining us today during Bingham Healthcare's Be Informed webinar series. It's been a pleasure having you here. Thank you very much, Dr. Wortham, for all the great information you provided with us for us today.
Yeah, thank you. Thanks for having me. Appreciate it.
You're welcome again, and thank you for taking time out of your schedule to provide some useful information to Idahoans.